to Tara as she comes forward and speaks with us.
Thank you so much. Well, good morning, everyone. I was so honored for getting the invitation from Ravina, your fearless leader. I worked with Ravina at the county level, at the state level, and so want to recognize her work and the team of NAMI Santa Clara County and NAMI California, which I didn't realize until today that NAMI Santa Clara County has over 40 staff members and team members. Is that 77? Okay, I got it wrong. That's an incredible team, and they're doing such great work, in partnership with my board, the County Board of Education, County Office of Education, and our key allies and partners. And so wanted to recognize that. And I think I also learned that this is one of your first symposiums since COVID. Is that correct?
This is actually your first symposium.
First symposium since COVID. So let's all applaud for that. And I'm especially honored for the opportunity to speak at this event dedicated to Minority Mental Health Awareness Month. And as was mentioned, my name is Tara Sreekrishnan. I serve on the Santa Clara County Board of Education and have a particular focus on addressing the mental health challenges faced by our youth. And as you heard from the introduction, the County Office of Education is an ally for our students, our 31 school districts, our over 270,000 public school students, and 80% of which of our students are students of color. And so we are one of the most diverse student populations in the country here in Santa Clara County. So for over 160 years, the county office has been dedicated to providing high quality services for our schools. And so when I joined the Board of Education, I was the youngest person to ever serve on our board. I was also the first South Asian American to serve on our board. But the next election cycle, we brought on 2 other South Asian women to join on the Board of Education and made history for diversity and representation. And so I've seen firsthand what happens when diversity and leadership is embraced and how it strengthens our ability to address complex issues like mental health with a broader perspective, with empathy. And so in the education field, we obsess over data, over numbers, which is great, but ultimately children are not numbers, right? They are humans. And so I think it's important to remember that, it's easy to get lost in the statistics and forget that behind every number is a student who has their own unique challenges, strengths. And so those of us who work in the education space don't need statistics to tell us that our children are in crisis right now. And the research corroborates that, but the lived experience as well corroborates that. Since 2017, rates of anxiety and depression among our children have gone up by 70%. Between 2019 and 2021, 1/3 of our young people experienced serious psychological distress, including a 20% increase in suicide. So our hotline crisis lines are on the rise. Visits to the emergency room for our youth is on the rise in our county and state, as I'm sure Joanna would tell you. And it's only faced an escalated, in an escalated way, exacerbated by COVID-19, right? So as a school board member with having education as my wheelhouse, my work has been more and more focused on health and supporting mental health of students, as anyone in education these days. So in that vein, I'm extremely proud and will be sharing how much the County Office of Education Board has evolved on issues around mental health since I was a student in our Santa Clara County Public Schools, thanks to the board's leadership, and I really need to recognize the leadership of our county superintendent, who NAMI works closely with Santa Clara County Superintendent Dr. Dewan, our staff as well, that have in recent years made sure that mental health is no longer stigmatized or disregarded in schools. We most recently announced our Hecka Well campaign. So Hecka Wells stands for Helping Every Child Know Authentic Wellness. And so it's a campaign very much in partnership with our youth, our students, to support students and staff to ensure that they are physically, socially, emotionally, and mentally well. So just in recent years, post-pandemic, we've launched groundbreaking initiatives that have brought together superintendents, allies, health experts, educators, and community leaders such as yourself together to address not only the symptoms, but find long-term solutions for wellness. So reflecting on my own high school experience, which was about 15 years ago, provides a stark contrast to the progress we've made today. So I graduated from Monta Vista High School in Cupertino. If folks know, it's well known for its academic rigor, its competitive environment. It's consistently highly ranked high school. And so for context, we're in a majority-minority community, and it was a majority-minority school as well. So 80% of the students at my high school were Asian American. So like many of them, and including myself, we come from families with very high expectations. And so, parents are engineers, doctors, and so this, especially for me, set the stage for an intense academic pressure cooker in high school, where success was measured by grades, test scores, college acceptance. So in high school, I was constantly stressed and sleep deprived. So like many of my peers, I often felt that my worth was tied to my academic outcomes. And so the culture at my high school glorified sleepless nights and overachievement. So it wasn't uncommon to hear students brag about how little sleep they got and wear that as a badge of honor. And I remember feeling inadequate even if I scored in the 90th percentile on tests. Anything less than perfect was considered subpar. It was a very competitive level. And so the pressure to excel academically has significant impacts on my mental health growing up. So I often felt overwhelmed, anxious, isolated, constant fear of failure, and also a sense that I had to hide my struggle and what I was going through. I didn't really have many resources on my campus to go to, so it's created a toxic school environment for me and many of my peers. We were often pitted against each other. It created a culture of schadenfreude. And to give some context, looking at wellness surveys conducted in recent years across the school district, which included my high school, it reflects some of the similar issues. So in a 2019 survey, it found that a majority of students at this district reported experiencing significant levels of anxiety and depression. Only 14% got the recommended amount of sleep each night. There was sleep deprivation, they were driven by demands for extracurricular activities, homework. And so the challenges I faced in high school were not unique to my community. A recent study found that mental health of college students across the country found that over the past decade, depression amongst college students has soared by 135%, with anxiety rising by 110%, eating disorders increased by almost 96%. And I can share in this environment that I personally have struggled with all three. Mental health challenges disproportionately worsened for students of color, notably American Indian, Alaskan Native, Asian, South Asian, Pacific Islander during the pandemic. We see a widening treatment gap for students of color that are less likely to access mental health services. Counseling centers lack cultural competence. International students face even more stigma and wider treatment gaps in mental health care. And as I'm sure everyone in this room can guess, mental health strongly influences college retention rates. And so students who didn't seek help were more likely to exit their higher education. So today, as a County Board of Education member, in partnership with our staff, I remain committed and bringing my lived experiences to my role to create more supportive environments that prioritize the mental health of our students, and working in partnership with districts across the county, including my former high school district, to create healthier and more balanced environments. So the rest of my speech will be a bit more positive. And so our goal is to ensure that students can thrive without sacrificing their well-being. So a pivotal step in this journey was the creation of the Santa Clara County Office of Education's Department of Student Health and Wellness. It is a department staffed with experts who have worked with NAMI Santa Clara County to bolster funding for student wellness. So since the pandemic, we have launched 20 wellness centers across school sites in Santa Clara County. And so these sites offer a range of services from counseling to mindfulness, sometimes even just a place for students to take a breath and take a break from their day. And they are all youth-led and have youth committees that give insight and recommendations on what these wellness centers should offer. So you heard about HECA-Well, now I'll tell you about SWAG, and SWAG stands for the Student Wellness Advisory Group that we host at the County Office of Education. And so our wellness centers have been having extremely positive outcomes. They are seamlessly integrated health and education. We've had over 10,000 student visits since only 2022 that have overwhelmingly positive responses. So along with SWAG and HECA-Well and our wellness centers, we have been on the front lines of our opioid epidemic that has been devastating many communities, including ours, and as I'm sure we know, is closely tied to mental health. So on the board and with the office, we've supported opioid prevention initiatives. As folks may be aware, the fentanyl crisis is responsible for 1 in 5 youth deaths in the Bay Area. And fentanyl-involved deaths is the fastest growing among those aged 14 to 23. It's 50 times stronger than heroin, 100 times stronger than morphine, so it's a crisis that's really hitting our youth. So the best tool we can use to fight this crisis is education. So the county office has not only been raising awareness about the dangers of fentanyl, working closely with our school districts, working with the DA's office, County Board of Supervisors, public health, on awareness, but also getting naloxone, known as its name brand, Narcan, across schools in Santa Clara County. And through these trainings around Narcan and naloxone, we've already saved students' lives. And so we've heard from teachers that the training helped them administer Narcan during an overdose to save students in Santa Clara County. So, and it's also led to state legislation like SB 10, authored by Senator Cortese, to get Narcan at all middle school and high school campuses in California. So when I think back on my own high school days, what stands out most are the struggles my friends and I went through. I saw classmates dropping out, a lack of engagement in the classroom, absenteeism, days where students didn't show up, discipline problems were common, and we tragically even lost peers. And so these memories stick with me and remind me that the mental health crisis isn't just a distant issue, it's happening right now in our classrooms. And students, teachers, administrators, and staff know that students' ability to learn hinges on whether their behavioral and emotional needs are being met, and so it's important to make sure these systems aren't falling short. So today, I believe we are on the brink of transforming our schools into true wellness centers. And this vision isn't just a dream, it's becoming a reality. It's a world where every student, from the moment they step into kindergarten, receives mental health support they need, regardless of insurance, health plan, or diagnosis. And in this new world, our schools foster a culture of wellness, addressing the whole child. Social emotional learning is part of the curriculum in this reimagined future. Students learn about mental health awareness, recognizing signs and symptoms, and they know where to find help. Teachers and staff promote mindfulness and wellness, while on-site mental health professionals work with students to build resilience, self-esteem, and coping skills. Professionals are not just treating issues, they're connecting students and families to vital services like food, housing, childcare, after school. Parents and caregivers are brought into the fold as well, receiving information about mental health awareness and helping break down the stigmas. Schools will play a crucial role in changing perceptions and encouraging families to seek the help they need. As we all know, the biggest hurdle to achieving this vision is sustainable funding for school-based mental health services, which California has been advocating for at the state and federal level. And this must be overcome. Administrators, health plans, and county mental health systems must collaborate to find a streamlined, effective approach. So here in Santa Clara County, with everyone here, I know we are committed to making this vision a reality, and we're already on our way there. And the results are very inspiring. Our new research from the County Office of Education shows that students are 10 to 21 times more likely to receive behavioral health support when they're available on a school campus. I'll say that again, 10 to 21 times more likely. When services are provided on a school campuses, that eliminates many barriers. It removes the need for transportation off-site, includes parents, encourages student self-referral, and increases the likelihood of completing treatment. So we found that when services were off campus, only a small fraction of referred families followed through. In contrast, 100% of families referred through school-based services receive the help they need. So these impacts are very profound. So thinking back on my time in high school, I see how much has changed and how far we've come, and I am filled with hope. The work we do now ensures that students in our community don't have to face the same pressures that myself and my peers did without support. We're creating a future where mental health is a priority for all students, regardless of their background, and wellness is a shared goal. So I'd like to end by thanking NAMI for being a part of this journey and for your dedication to making a difference in the lives of our youth. So thank you so much.
Thank you, Tara. So right now what we're gonna do is we're gonna have a 10-minute break as we move our panel to the front.